Many thanks for joining us. You're watching QTV News and we're coming to you live from our studios on Caraba Avenue. I'm Ansmane Sonyasi and first the main news headlines. It is estimated that non-communicable diseases account for at least 34% of adult deaths in the Gambia. The Ministry of Transport, Works and Infrastructure is to introduce a route licensing scheme for some commercial vehicles aimed at improving the efficiency of the transport system in the country. The Gambia Autism Society today commemorated World Autism Awareness Day, which is annually recognized on 2nd April to raise awareness about people with autism spectrum disorder. And the United Nations Office of Project Services on Thursday convened stakeholders to share the overview of the Greater Banjul Area 2040 Development Plan that seeks to address the challenges around the Greater Banjul area. Well, those were our main headlines, and now we take a look at the news in detail. Now, it is estimated that non-communicable diseases account for at least 34% of adult deaths in the Gambia. The alarming prevalence has posed a serious threat to our socio-economic development and the health system. Maudlamin Choi reports.
Non-communicable diseases refer to a group of health conditions that are not mainly caused by an acute infection, and when one is affected, result in long-term health consequences and often create a need for long-term treatment and care. Examples of major NCDs include diabetes, hypertension, chronic respiratory disease, cancers, and mental health. Omar Baje is the Program Manager, NCD Control and Prevention at the Ministry of Health.
I can say that there is no household in the Gambia from Koina to Karton that is not either directly or indirectly affected with NCDs.
Use of tobacco, harmful alcohol, eating unhealthy diet, being physically inactive, obesity, and pollution expose and increase the chance of a person developing a non-communicable disease. According to a national population-based health examination survey, more than 90% of adults in the Gambia have at least one risk factor of NCD, out of which 22% experience at least 3, while 7 are exposed to none of the risk factors. Among the risk factors listed, exposure to or use of tobacco contributes to all the major non-communicable diseases highlighted.
For 2018, NCDs account for 34% of all deaths in the country, meaning all deaths in the country, 34% is due to NCDs. It will be diabetes, hypertension, cancers, and chronic respiratory diseases, stroke, and the other things. So it counts for 34%.
Prevalence of non-communicable diseases among adults in the Gambia continue to shoot up at an alarming rate. For example, hypertension and diabetes prevalence in the country stand at 29% and 6.7% respectively. Dr. Abubakar Jah is the Medical Director of Sarab Medical Center.
Every day, it's not now a matter of once in a while. It's every day we see a lot of people who are coming in because of complications of non-communicable diseases like the ones that we have mentioned. Diabetes, high blood pressure, obesity, high cholesterol levels, and all those type of things. So it is really, really very common now.
Non-communicable diseases are incurable and can be severe to a person's health condition when it becomes chronic. According to statistics, every month there are at least 9 NCD-related operations on patients, out of which 6 are amputated.
And sometimes the medical doctors or the health professional, there is nothing that they can do, especially on diabetes. When you have chronic conditions and the diabetes food, it comes worse to the worst, and there is nothing that can be done. They have to amputate you. That's what they can do.
Control and prevention of NCDs require a healthy lifestyle that is free from tobacco use, harmful alcohol intake, doing regular physical exercise, and eating healthy diets.
Now, if the government was to spend money in making sure that people are physically active, in making sure that healthy food is available, they will save a lot of money. The government will save a lot of money in terms of, number one, people being absent from work, because people being absent from work is cost. You save money from hospital costs. How many people are going? Every day I see in this small clinic several people with non-communicable diseases. Now, if we were able to reduce that by half, the savings itself will be a lot of saving. If you go to the public hospitals also, it is cost for the government. People pay $25 for a ticket. That is not what it costs the government to make sure there's a doctor, to make sure there's a nurse there, to make sure there are medicines there. It's a lot of cost. So if the government can reduce the amount of non-communicable diseases that we are having to deal with, they are going to in fact save money. So the money they invest in making people healthier is going to save them money in the long run.
Nearly half of the population of sub-Saharan Africa has non-communicable diseases, making it the highest worldwide. The socio-economic burden of NCD is expected to increase in the Gambia if preventive and control measures are not taken. Mahmoud Lamin Choi, QTV News.
The Ministry of Transport, Works and Infrastructure is to introduce a route licensing scheme for some commercial vehicles. The pilot project for selected routes aims to improve the efficiency of the transport system in the country. Ajibintu Drame went out to gauge the opinion of both drivers and commuters about the new scheme. Here's the report.
In order to ensure smooth implementation of the scheme, the Ministry of Transport selected 21 routes within the Greater Banjul and the West Coast region as a pilot project. The Ministry of Transport, Works and Infrastructure says the new scheme applies to commercial vehicles licensed to carry 10 passengers and above. Vehicles should register to one route within the ministry's officials who will be going around the designated destinations, which are Banjul, Serekunda, Bakote, former Tipa Garage, Burusubi, Costa Road and Birkama. Abdou Jallo, a driver, plies various routes within the Greater Banjul area. He says the new policy is not favorable because the price of petrol is high. He further shares his thoughts.
The Serekunda route is mostly congested. We have to use other routes like Turntable, which is less congested. But if we have to register for only one route, like Westfield Banjul, that will be difficult for the drivers.
The Ministry of Transport emphasized that vehicle and drivers that do not register from one of the selected routes cannot ply the routes. Suleiman Jiba, also a driver who plies the Serekunda Birkama route, welcomes the new scheme. However, he says more needs to be done to address challenges faced by both commuters and drivers. Usainu is a driver plying the Westfield Banjul route. He welcomes the initiative.
It is a very good initiative. This will make drivers operate one route. But sometimes there are no passengers, which force us to ply other routes because the price of the fuel is high. Therefore, the government should help us. The price was $52, now it is $58.
In the new scheme, permits and stickers will be given to drivers during registration, which started this week. Ramu Kamara, a commuter, also endorsed the initiative. I support the route licensing scheme. It is better for the commuters. It has been a burden on us. If a commuter does not have enough money, it will be difficult to get to where you want to go. If you want to go from Westfield to Birkama, the driver will say Latakunda, then Tabakoto and Lamin. From Lamin, they say Busumbala. It is a hustle every day. So this will make drivers go direct to selected destinations. This will help reduce the burden on us. The Ministry of Transport is taking this huge step following a public outcry over the persistent and unlawful increase in transport fares, with many complaining about drivers creating illegal stops and asking for extra fares, and it is the same for other parts of the country, especially within the Greater Banjul area. Achipintu Drame, QTV News.
Now, the Gambia Autism Society today commemorated World Autism Awareness Day, which is annually recognized on April 2nd to raise awareness about people with autism spectrum disorder. Loliam Kamara attended the event and she now reports.
The Gambia Autism Society is a non-governmental charitable organization that aims to raise more awareness about autism in the Gambia. The theme for the event is Let's Promote Autism Inclusion and Acceptance in Our Communities for the Autistic and Their Families. According to research, autism refers to a range of conditions characterized by challenges with social skills, repetitive behaviors, which affects the way an individual sees or communicates, which makes their social interaction difficult. Ajigas Jara, founder of the Gambia Autism Society, explained how the foundation was formed.
A friend of mine, he works with the Autism Society, sorry, not the Autism Society, autistic kids in the UK. So he introduced me to autism. And at the beginning, I didn't know what it was at all. So to my curiosity, I went and do my research. And as a child growing up in the Gambia, when I was younger, I must have come across 2 or 3, kids with the signs and symptoms of autism.
Ajigas Jara further stated that autism is a condition which needs to be addressed. Thus, raising awareness is a worthy cause.
We've been doing it, and we've been going to schools, we've been going to communities, to villages, sensitizing people to do radio interviews, programs, people calling in, visiting us, and it's there, it's out there, people need help.
Modupe R. Afis, a representative from the Special Olympics Gambia, whose child is diagnosed with autism, thanked the Gambia Autism Society for making the day memorable and a step in the right direction.
Autism is not alone by himself or herself, They come from a family. They are part of a society. So when the family members get to know more about the condition of their ward, and the society gets to know more about the condition that their fellow citizens are facing, it becomes easier, for them to embrace it, for them to support such people with this condition.
Modipe shared with us some of the challenges she faced in supporting her 15-year-old son.
I'll give you an instance. Maybe there's a loud noise from somewhere, from all of us here without such condition. We'll be able to adjust ourselves. But they can't. Sometimes they go into a huge tantrum, and it will take minutes to bring them down. So when you have a child or a ward with such condition, imagine you being outside, and suddenly there's a loud noise which you cannot control, and this is the reaction the person can this is how the person reacts to it because of the condition the person is going through. It becomes a situation that you have to manage.
Ajigas Jara and Modipe have this message for parents caring for their children with autism.
If you are aware of something and you don't believe in it, what's the point? You're not going to follow it, you're not going to practice, you're not going to, take any measures. But if you accept, that's something else, that's another step. So the acceptance is what we're crying for. That's the theme for this year, post-pandemic, autism acceptance. Let us all accept and embrace autism.
It's not something that is a curse on your family, no, it can happen. People have sickle cell, it's not different. You will manage it, So it's not your fault. Accept it, because what you don't accept, you cannot embrace it.
Dembaba, a principal at Interior Academy, and Rod House, executive director of the Gambia Federation for the Disabled, both commended the Gambia Autism Society for the commemoration and encouraged students to accommodate their colleagues who have autism. Reporting for QTV News, Lolly M. Camara.
And our report there by Lolly M. Camara will lead us to a short commercial break, but we'll be right back. Stay tuned.
Your favorite QCell service has gotten bigger. eFunkanta. Now you can loan bigger credit amounts to make life easier for you. Loan $75 and $100 and pay later. Yes, you heard me right. Get credit loan from $10 to $100 using eFunkanta by dialing *393#. Anytime you run out of credit, whether you want to buy Q-Power, browse the internet, make urgent calls, or send SMS. eFunkanta is the service for you. Dial *393# and choose the loan amount of your choice with no hassle. For more information, call our customer care on 111. QCell, Sunyabus, the pioneers of mobile loan service in the Gambia. We innovate, others follow. Terms and conditions apply. It's happy time. Get 50% off all calls to any network. Enjoy calls every day to any network from 6 a.m. to 10 a.m. Is it too good to be true? QCell. We innovate, others follow.
Welcome back from a short commercial break. Be reminded you're watching QTV News and we're broadcasting live from our studios on Carver Avenue. Now, after 2.5 years working on a sustainable urban development plan, the Greater Banjul Area 2040 Development Plan, the United Nations Office of Project Services on Thursday convened stakeholders to share the overview of the project as it ends. As Alucicio reports, the plan seeks to serve as a framework in addressing the challenges around the Greater Banjul area.
Rapid urbanization has now become a global issue, and according to reports, the Gambia has one of the fastest urbanization rates in sub-Saharan Africa. The report on Sustainable Urban Development Program 2020-2040 indicates that the Greater Banjul area already accounts for 68% of the total population. This has resulted in several environmental and socio-economic problems, including deforestation, soil erosion, pollution, and waste generation, as well as stress on health, education, and employment services. It is in this regard that in 2019, the African Development Bank, in response to the Gambia government's desire to integrate urban planning and development, extended a 3 million grant to the Gambia for sustainable urban development of the Greater Banjul area. The activities of the project included capacity building and the formulation of a master plan for urban development using digital technologies, which are intended to greatly improve the operational efficiency of the three municipalities, Banjul, Kanifing, and Brikama, and also provide support to the Banjul port expansion. Speaking at the closing ceremony of the program, Ms. Agaf Nugaret, UNOP's country manager, whose office spearheaded the planning process, revealed that over the past 2 years, the planning team has collected data, reviewed reports, consulted hundreds of citizens and technical experts to produce a development plan.
It started as early as March 2020 when we had 120 people in a room that was just before everything closed down to talk about the urban vision, and it culminated during the public exhibition in which we took the results of our work to the population of the Greater Banjul area with more than 600 comments received from visitors.
The Development Plan 2040 will in the short and long term address the significant challenges mounting around the largest and most dynamic areas in the country. Yaya Drame, Deputy Permanent Secretary at the Ministry of Finance and Economic Affairs, believes the plan will provide guidance when making decisions or carrying out actions that pertain to the interrelated themes of future population growth, land development, environmental conservation, economic growth, and social well-being.
The Greater Banjul 2040 Sustainable Urban Development Program is important in the sense that it lays a solid foundation for integrated urban development within the Greater Banjul area, which will go a long way in addressing the many development challenges.
For Mamadou Manjang, Director of Department of Physical Planning at the Ministry of Lands, the implementation of the project therefore requires commitment from stakeholders, both national and international, to realize sustainable development goals are set out in the development blueprint.
We've been experiencing that there are a lot of developments going on due to the rapid development, and this has seriously affected the ministry, and it has also the ministry has found it difficult to control those developments.
The previous development plan for the GBA was approved in 1985. However, it was never implemented or updated. It's outdated and doesn't respond to the economic activity, new social interactions, and emerging development patterns. Copies of the development plan were shared with stakeholders. Reporting for QTV News, I am Aliou Cisse.
Now, Farafenni Senior Secondary School Sports Department on Sunday organized Walk for Health to foster unity among students and institutions in the region and to burn off unhealthy fat. This report by Don Williams is narrated by Geneva Sonko.
Physical exercise plays an integral part in our health and development. Participants walk from Farafenni Senior Secondary School to Charlotte Village, which is several kilometers away. Ibunjai, a teacher and Secretary General of the school's sports department, explains the objectives of organizing the event.
The core objective for this Walk for Health is to see how best we as a sports committee can give back to the community. And the only way that we believe we can give back to the community as part of our social corporate responsibility is to do something that will help in promotion of health within this community. And as a result of that, we organize a Walk for Health where people can walk for distance and burn a lot of calories. This will help us in taking part in the fighting against some common diseases like asthma, like this high and low blood pressure, like diabetes, which is so common, particularly among government workers, if you can see, as a result of lack of exercise.
LF Keita, a fire and rescue service officer, says exercise is healthy.
Work for your health is a good initiative, and then it is good for you to be part of it. Walking from a distance, it improves your health condition.
Exercise has effects on the heart, muscles, bones, joints, and regulation of our hormones in the body. Suzanne Shako, a student and participant, says exercise, especially walking, make her feel okay.
I came here to participate because they told us that it's work for health and it's good for our health, especially people like me who do not feel fine. So it's advisable for us to come and walk a little bit and have some exercise so that at least we can free our body a little bit.
Ancha Bite is also a student and participant. She believes walking will help her lose weight.
And like we will free our body. People like me, we are not small. Like it is good for us.
The aim of the event is to promote a healthy lifestyle through physical activity. Walking at a pace for at least 30 minutes a day has proven to drastically reduce your chance of developing heart disease, cancers, and dementia. Reporting for QTV News, I am Jennifer Sonko.
And I'm afraid that's all about it for this bulletin. But before we take a leave of you, here's a recap from main headlines. It is estimated that non-communicable diseases account for at least 34% of adult deaths in the Gambia. The Ministry of Transport Works and Infrastructure is to introduce a route licensing scheme for some commercial vehicles aimed at improving the efficiency of the transport system in the country. The Gambia Autism Society today commemorated World Autism Awareness Day, which is annually recognized on 2nd April to raise awareness about people with autism spectrum disorder. And the United Nations Office of Project Services on Thursday convened stakeholders to share the overview of the Greater Banjul Area 2040 Development Plan that seeks to address the challenges around the Greater Banjul area. That is all we have for you in this bulletin. Do join us at 10 p.m. for more news. Until then, thanks for watching.